Welcome to the Valaura Exchange, where leaders connect the dots between health, humanity, and performance. Each episode brings real conversations, fresh perspectives, and the insights shaping the future of how healthcare leaders understand and solve today's most pressing challenges.
Predictive analytics has really become table stakes in healthcare. Most organizations today can identify which patients are at risk, whether that's non-adherence, readmissions, or even gaps in care. But what we're seeing more is that prediction alone doesn't actually change the outcomes. At Valaura Health, this is something we think about constantly. Identifying risk is important, but what really matters is what happens next. How those insights translate into patient engagement and also better outcomes. And that's where we tend to see things break down. For those joining us for the first time, I'm Teresa Connolly, and I'm the Director of Clinical Business Development here at Valaura Health.
Yeah, and especially in our work around medication adherence and patient engagement, we've seen that identifying at-risk patients is often the easier part. But the harder part is operationalizing that insight, connecting analytics, clinical workflows, and patient outreach in a way that actually drives behavior change. Thanks everybody for joining us. I'm Ifham Ahmed, the Chief Clinical Officer here at Valaura Health.
Thanks, Ifham. Today, we're excited to dig into that gap between prediction and impact. We're joined here today by Sai, who spent time leading data science teams working on real-world healthcare problems. And he's now working closely with N1 on applying analytics to patient engagement and outcomes as well. Sai, we're really glad to have you here with us today. Just before we get started into the questions, would you mind just going over a little bit of a background about yourself and the work that you're focused on today?
Of course. Thank you guys for having me. Sai, I lead product here at N1, so I've been here for over 5 years at this point, and what we're really focused on is how do we use data, predictive models to be able to make healthcare more proactive, predictive, and personalized. So a lot of the challenges that you kind of talk through, we're facing on a day-to-day basis of how do we partner with our health plan customers to be able to take a lot of underlying raw data, turn them into actions, and be able to get member health outcomes is sort of my focus.
Awesome. And that's really helpful context because it ties directly into something that we see a lot here at Valaura as well. And I guess for the first question, just wanted to go a little bit deeper into organizations and where do you see organizations confusing prediction with impact when it comes to patient engagement?
Yeah, it's a good question. The most common failure mode that we see is what I would call model worship. So health plans invest heavily in predicting who is at risk, but they treat that prediction as sort of that final deliverable. We think the hardest part is actually taking those predictions, understanding not just who the members are, but more importantly, why are they at risk and what can be done to help those members. So for example, a model can tell you if a member is likely to miss their statin refill, but doesn't necessarily give into insight of what are the underlying barriers that might lead to that refill being missed. Is it transportation access? Is it the member just had a fall, so they have impaired mobility? Is it the member is socially isolated, needs more hands-on support? So really understanding that next level of detail at the individual level is really what allows organizations to run targeted campaigns, trigger the right outreach through the right channel at the right time. And lastly, another challenge plans have is how do you actually capture all of that outreach and be able to dynamically, and really this is within days and close to real time as possible, how do you understand if that outreach had impact? Did it cause behavior change in members? And most importantly, what can you learn from that outreach to iterate on both the engagement strategy as well as retraining some of your predictive models?
And I would say one thing that I wanted to ask, because I've dealt with this myself too. So you mentioned the worship part where we're really focused on predicting and making sure that we know what the risk is. But like you said, mentioning and digging deeper on your end of like what the actual barriers, what's the outcome. For healthcare organizations, would you say that that is usually where the struggle is, where they might be able to take that action from you, for example, you're developing a list for them, but like, is it more so the struggle is operationalizing that and being able to build on what your team has put together for them? Or are there other things that the organization tends to struggle with?
Yeah, I think operationalizing it is definitely one of them. I would say really a lot of health plans are focused on kind of the who needs certain actions. I think health plans in the last even 3 years have focused a lot more in analytics and predictive AI. But again, that's been really focused on the who. I think that next jump and really where people start to get a lot more outcomes is when you take the who into the why and the what. And that really involves a lot of actual collaboration with data science teams, a lot of operations teams, right? I think even kind of our work together in the past, being able to combine data with sort of the know-how, the subject matter expertise really allows organizations to take that next jump into being able to go from data to action. And that's really what members see, is if you actually kind of lead, with a member, a help first outreach, that's really where they start to build trust and build engagement long term.
Oh, that's very valuable insight, Sai, and thanks for that. We just wanted to build on what you just said for a little bit. So what we here think about at Valaura is like, what happens after outreach? How do systems communicate with each other? How does feedback loops happen across different channels when you're engaging patients over different channels over time? What are your thoughts on some of those things?
Yeah, I think that's probably the most important piece of what I think, how do you actually operationalize predictions, is how do you make sure that you have a feedback loop in place that you're learning and improving over time? I would say most health plans have what I would call sort of like an open loop system. So they push outreach, 3 to 6 months later, someone runs a retrospective to see if anything they improved, or they push outreach, get the outcomes data back, and that goes into more of a dashboard. That's not really a feedback loop. It's more of a measurement system or a post-mortem. A real feedback loop, I would say, has 3 properties. It's continuous, it's channel aware, and it updates the model. So putting that into practice, so what we do at N1 is we run a campaign, we capture the outcomes data in near real time. So being able to understand, did a member pick up? Did they not? Did they schedule? Did they complete the action? And that signal really flows back into a lot of the analytics and modeling that we do. So all of our models are getting retrained from that. They're learning from it and improving. And then similarly, a lot of our outreach member recommendations adapt to it. So being able to know that for a member who ignored 3 telephonic calls but responded to a text message, that's critical, but I think a lot of plans miss that. And that's really, telling, because for members, you want to be able to improve the experience in abrasion or reduce the abrasion. So being able to actually take that feedback loop, capture that knowledge, and route it accordingly is where we see a lot of plans fail. And that's kind of the biggest point that they need to improve on.
That's very fascinating and kind of ties into our thought of tying this all into behavior change. I guess what engagement signal would you say matters the most? You mentioned some of them that you feed into your analytics and data system. In your guys' work, what matters the most?
Yeah, I think making sure that members are getting the right channel, right? So if you know historically a member has consistently engaged via telephone or engaged via SMS, making sure that you're using that knowledge when doing the next set of actions. The second is also more of the message that the member gets. So really it goes from what channel to also what message is. Members are, I think, getting more and more calls, outreaches. They don't want it to seem like spam. So being able to understand what does the member actually need? What is the member facing in terms of their experiences and barriers? And how can you lead with a message that's more personalized to the member is what we see work significantly. There's also additional signals, such as, like, for example, if you know a member is digitally accessible, being able to use things like email, app activations, that sort of thing. I think the other thing that we've seen consistently is also time of day, day of week. So really being able to understand from historic outcomes, like what works, what doesn't, and be able to create a specific strategy at that individual level.
And we've seen that a lot in our work as well, having the appropriate and correct choice of outreach and having the correct method and timing is very important as well. So thanks for that insight for everyone listening.
I think with all that being said, since you talked about almost how everything's put together, now we're getting right to what I wanted to ask, which is about next best action. Like, where do you see that typically break down, or there's maybe more difficulties with being able to leverage that component with health plan customers when you're working with them?
Yeah, I would say there's a couple places probably that it breaks down. And I would say all of that is really upstream from the actual algorithm and the technical components themselves. So the first one is really the action space, I think, is a little too narrow. So most next best action implementations really try to offer a choice between, do we call this member or do we send this member a letter? That's not really a meaningful next best action per se. I think a real next best action needs to consider what campaign, what channel, what timing, what message, what's the clinical real context? Has this member already been contacted about something else? So really at N1, what we're doing is providing that orchestration layer. So really being able to understand for individuals, what's the suppression logic? What's the channel sequencing? What's the intervention stacking? Because bombarding a member with 4 different gap closure messages in the same week, even if it is sequential, it's not really next best action. It's still sort of kind of the spam layer. So what we want to really start with is understanding what all is actually happening within the plan. So being able to understand for each individual, what are the different communications that are going out for them? What are the different campaigns that people are involved in? So the big piece of it is how do we actually centralize a lot of those outcomes data, know what campaigns are happening, what's about to launch, and be able to get a view of here's all of the touch points that are happening this week. Here's all of the campaigns that are going to be happening in the next month. That's really the start of the next best action framework. Another place that this breaks down in, even if you have all of that intelligence layer built, is it's really hard to get all the operations teams into one room and sort of prioritize outreaches. Because I think a lot of times you might have one team really be focused on here's my goal. So I think my outreach is more important versus another team might say the same thing. So really being able to kind of coordinate across teams is a big challenge and an operational constraint, but really starting with at least kind of the data centralized, being able to come up with the predictions at the individual level and the recommendations is where we would start. And the last one I would say is, a lot of times member behaviors aren't static, right? So one of the other issues that we see with predictive modeling is, plans might run predictive models every once a year, or they might run it every couple months, but real life is constantly changing, right? So a member might have lost their car, a member might have had a new person come into the house, whatever it might be, they might have moved. Members are consistently changing. So being able to understand all of that from as close to real time as possible and use that when you're actually creating your segmentation and your next best action is really what's most important.
No, I completely agree. And actually, well, first of all, I completely remember us working together with all the different teams trying to orchestrate, because that is one of the most challenging pieces that we've come across as well. Just making sure all the stakeholders align. They actually want this messaging to go out. They're good with one measure being prioritized over the other. It's a lot of moving parts. So I definitely agree with that part. And you kind of read my mind on the real-time part. I just wanted to see if you could drill in a little bit more about truly what would the ideal frequency be to refresh your model? Are you thinking are we talking daily, weekly? Just curious, from your perspective, because I know we had limitations operationally sometimes where certain teams can't do it as frequently as daily. Do you have a preference? Is there anything that you've seen in the workspace that I guess would be ideal for that?
Yeah, I think obviously coming from a data science angle, I think the more data, the more frequent, the better. So I lean daily, but I think in terms of what we've actually seen with health plans be, I would say more realistic is at least weekly. And I think the latest it could be is biweekly, because again, members are consistently changing as their real life is changing. They might have other, you might have an ED visit that pop up, and you need to be able to know that before you give any sort of next best action. So at least from a current standpoint, I would say daily is ideal. Weekly is sort of the kind of, I think, operational ideal, and then biweekly is sort of kind of that minimum.
That makes sense. Thank you.
Thanks for that. I think a big theme that's come out from this conversation and a big takeaway for a lot of people is that there's not an issue with having data, right? Data is available everywhere, but operationalizing that data. So in your mind, in your experience, the organizations that are successful, what does that alignment look like between data and analytics and their operation? What's the perfect execution method that you've seen? Where are some plans lacking, some organizations lacking?
Yeah, that's for sure. I don't think data or not having enough data is the problem. I think the next level of issue is really what's the right set of data that you want to use to make a decision. So I think there's obviously too much data at some points of really being able to understand what is most relevant at one point. And really, I think the biggest thing that we've seen health plans be successful in, or who are the health plans that want to have a culture of experimentation. So I think there's a lot of times that initiatives fail if you're trying to over-engineer or over-optimize for things, you'll never actually get off the ground. So you might actually take 3 months to get something off the ground versus the plans that go quicker, run more agile iterative cycles. They might actually have 3 months of learning that comes in. So I think with data at all times, it's really compounding. So the more things that you actually get out there, the more actual iterations and A/B tests you're able to run, all of those learnings kind of come back in. They're feeding that feedback loop that we talked about. The models are getting better. Those A/B tests are also trying to explain, here's what works for your members, here's what doesn't. And over time, what you'll see is kind of a graph that's trending upward, right? You're learning more things, so outcomes are getting better over time. So I would say the biggest thing that health plans can do, and where we've seen them most be successful, is deciding on, here's a certain action that I want to go after. So picking that use case, picking, here are the members that I want to go after with, here's some of the channels, here's the outreach, and then actually deploying that outreach rather than trying to over-engineer it and over-optimize.
No, definitely. It seems like that having a direct vision and executing it is pretty much what helps lead to success in your experience. So thanks for elaborating on that.
I know I'm adding in questions, but I know you'll know the answers because we've talked about this before. I was wondering, just for health plans too, to help them understand like what goes into the modeling, would you mind sharing what types of inputs you typically prefer, or like you see in your organization that you like to leverage to help with like these insights that you're talking about and making it more real time, more agile, like you said, and targeted? Like, I guess, what would the health plan need to supply to really optimize their model, if that makes sense?
Yeah. I think first thing from a lot of health plan standpoint is really just kind of, I would start from a data of like, what are some of the components of data that we need, things like membership roster, claims, et cetera. I think the second biggest things from a health plan is really, what are we trying to optimize for, right? So again, if I'm coming at it from a med adherence angle versus a risk adjustment angle versus a cost of care angle, I think the tools you have in your tool belt change. I think also from a member experience standpoint, if you're trying to prevent an ED visit versus trying to get a diabetes fill, a lot of that is so different. So I think being able to understand kind of what data do we have, what's the goal that we're trying to go after, and then really I think kind of the piece that I enjoy the most is really like, what is the team that's really deployed on the ground for this, right? How are we, all focused on that specific goal, brainstorming together, creative problem solving together? I think going back to my last answer around like A/B testing and iterations, it's not really always, just randomly made up, right? It's like sitting in a room whiteboarding together and like, oh, we should go try this, or we should go look into that. So I think all of that combination of kind of the data, the operational teams, and then actual model outputs coming in and being able to deploy that is what's most important. Because I think there's a lot of times the data will tell you also, here's what's relevant versus not, right? You might see that people that moved in the last 90 days actually have a higher rate of misfills. So now that's something that the campaign told you about. Now the operational team needs to sit together and figure out, okay, what do I do about that, right? Data is only useful as kind of whatever intelligence is being added in operationalizing that. So being able to actually make changes to campaigns and outreach is truly the biggest thing.
I completely agree with you there. And with analysis, so like we love data, we love to analyze. How would you say we, and I should say like all health plans, all leaders out there could try to avoid the analysis paralysis syndrome? Because I feel like that is one thing, like looking at the data, because I know you have amazing insights, just getting away from maybe overreading things. And like you said, getting to the action so you can actually pivot and change course to help a member. Any tips there? Just thought that would be useful for our audience, because I think we all get stuck in it, to be honest. Like there's too much data in the world, right? So
yeah, I always like it from kind of what's the hypothesis? What are you potentially looking for? What's the data saying? And then there's always like multiple layers deeper that you can go into. But I think kind of finding that right balance between how much thorough should this analysis be versus, okay, what is this saying? What should I change from a member action standpoint? Let's actually go test this out, see how this works in the next month, and then let the actual outreach and the outcomes data and the member experiences actually dictate what's working and what's not. So a lot of times when we do that, there's also times we go collect member quotes, or if we're working with like outreach, different teams, the outreach teams also give very good qualitative feedback, right? So whether it's underlying member quotes they're capturing themselves, or even their gut feeling around, I do think members are actually more receptive to this sort of outreach versus not. So I think it's really that combination of let's go, get a good confidence level. So I'm not saying we should just go do a lot of changes without any data to support it, but as long as there's some data, there's some support, there's good confidence of we should go after this, making the change, and then really letting the data, the members, as well as the outreach kind of tell that qualitative and quantitative story of here's what worked, here's what didn't.
that makes sense. And I would say, I guess overall, just making sure you have maybe some leading indicators, some sort of target criteria, something to kind of help with guiding you. Like you said, like basically you have a baseline, you have great data, now let's act on it. So everything you said makes total sense, and I completely agree there. So I guess I get to close this out with the last question. If you were advising a healthcare leader investing in predictive analytics today, what's one thing that you would tell them to build before they build another model? And also, by the way, you can add in any other feedback you'd like besides that, because I know we've asked you a lot of questions and we just want you to be able to share any insights that you want to with the audience as well.
Yeah, I think probably the couple components that I would say is one, making sure that the predictive capabilities themselves are explainable, right? Another thing that we typically see in the industry is, again, if we're trying to over optimize or over engineer for like an AUC score, for example, and we're throwing a lot of things at it, sure, it might get better, but if it's not truly explainable and you can't connect it back to the member experience, I truly don't think, again, in our kind of healthcare engagement landscape, it matters as much. We need to find that balance between explainability versus like performance and try to optimize for that. I think the second piece of it is also having a plan of what's the point of, I guess, doing the predictions. So as long as you have, here's the next set of things that I'm going to do, really clearly having, here's how I'm going to operationalize it. Here's the teams that I have at my disposal that are going to take this and run with it. Where we actually see a lot of these sort of programs fail is we might build a great model, but if there's no underlying team that's going to take it and run with it, and really, again, tying it back to the member engagement and experience, now it's just a failed science experiment. So really being able to figure out what's the model, how am I going to build it, how do I make sure that it's good performance, but also explainable? How do I then take that to have the right resources, outreach capacity, all of those capabilities am I kind of in front of me? And then the last piece of it, and I tie back to a lot of the member experience, is want to kind of iterate that like the models themselves are saying the who, but making sure we have that next step in data of what's the what, what's the why, and how do I combine all three of those elements so I can start to identify, here's the members I want to go after, here's what I want to say to them, what channel, here's the message that I want to be able to give. So really being targeted and personalized is really where we see success. So making sure that I think a successful program has all of those components, not just one of them.
No, I agree with that too. And the closed feedback piece, like you mentioned, making sure that everything ties back together and keeps iterating. And then like you said too, you can also evaluate the data better that way. So excellent advice. Thank you.
No, and it's great insight, Sai, and thank you so much for joining us today. I just think that this conversation happened at the perfect time. As you know, in our field and across organizations, the big spending and big investment is happening in predictive analytics. So just being deliberate and being methodical about how you spend and how you build these models. The data is just not the data. You have to operationalize it. You have to execute well on it. So thank you for all your insights today. I know all the viewers that are listening in and watching, they'll find the insights very useful. I would say if they wanted to see more of your work or follow more of your work, where would they go? Do you guys have a LinkedIn page, a website, anything else that you publish where viewers could find out more if they wanted to?
Yeah, I would point them to definitely our LinkedIn website. And then also we're trying to kind of do more blogs too. So really being able to take a lot of the product capabilities we're building, the analytics, the case studies, and the outcomes, and trying to actually put that out into more, especially from a learnings capability standpoint. So I would point them to those.
Awesome. Thank you.
Well, for organizations like ours at Valaura, focusing on improving both patient engagement and also medication adherence, this is really the challenge that we've been working to solve, and really glad to be working with you too on the collaboration activities. Organizations that succeed just won't be the ones that have the best models, but they're also going to be the ones that know how to actually use the data. And then, like you mentioned, reiterate, keep a closed feedback system, and be able to evaluate and act on it with cross collaboration across the teams. So Sai, thank you so much for taking time out of your day to chat with us. It was very insightful. We really learned a lot ourselves and continue to look forward to more of your work. And again, just for everyone watching us today, thank you for viewing us. We hope that you enjoyed our content, and we'll continue to produce more information to help you succeed in this very complex healthcare environment. So thank you for tuning in. We appreciate it.